Minister MacLeod has been working day in and day out to make sure that we have a sustainable system for families that have children with autism. Again, Minister MacLeod, she wears her heart on her sleeve. I would never ask Lisa MacLeod. She's an absolute all-star. I would never, ever, I want to repeat that, ever ask Lisa to resign. She's done an incredible job, and let's just make sure it's factual.
The opposition New Democrats are calling for Ontario's Minister of Social Services to resign over what she allegedly said to an autism group. According to the Ontario Association for Behaviour Analysis, their staff met with Lisa MacLeod days before she announced changes to autism funding. The group claims the minister told them if they don't support the changes, it would be, quote, a long 4 years. MacLeod hasn't specifically denied that exact claim, and Premier Doug Ford is resisting calls, as you just heard, to remove her from cabinet. So how is the group reacting? Julie Cowdis is the chair of the Ontario Association for Behaviour Analysis Scientific Expert Committee for the Treatment of Autism Spectrum Disorder and joins me now from Toronto. Hi there, great to see you. Thank you for your time.
Hi, thank you for your time.
So can I ask you to start off by kind of laying out for us and our viewers what happened between your organization and the minister's office in the lead up to last week's big announcement of changes to how the government will fund autism programs?
I can, yes. We had an initial meeting in September with several of our ONTABA members or representatives, and following that meeting there was no communication between MCCSS and ONTABA. That initiation, or that communication was initiated again in January, and at that time we had a meeting scheduled. We were very pleased. We understood that the ministry was looking at changes to the autism program at that time, and we were looking forward to collaboration with them and to discussing how to move forward, how to address important things like the wait list. However, at that meeting, it was quite a prescriptive meeting where the issues with the current program at that time were laid out for us, and general suggestions for how the program was going to be revised were given to us, and we were asked if we could provide a supportive statement at that time.
And what was your response?
That in order for us to responsibly make a statement supporting a treatment program for this vulnerable population of children in our society, we would need to know all of the details. So it's important whether children receive 20 hours of treatment or they're going to receive 2 hours of treatment. It's important to know what the type of treatment being offered is. And none of those details had been shared with us, and so we didn't feel that we could responsibly support a program that we simply didn't have enough details about.
So when your group said, no, we aren't going to support this, what was the response?
There were several meetings that occurred after that point in time, and I was a participant at the first meeting and my colleagues were in the follow-up meeting, and I think it would be fair to say that it was disappointing to the ministry, I believe, that we didn't provide a positive statement for the program. And as we indicated to our membership in a communication that was intended for our membership, we were informed that it would be a long 4 years for us without that statement.
How did you interpret that at the time?
We interpret it as we would be cut out of the opportunity to help grow and develop this program. We have 1,200 members in our association. We're not a huge association, but we are the largest association of behaviour analysts in Canada. And many of our members have been working with children with autism and their families for over 20 years. We have lots to offer to help build a strong program, to continue the legacy of evidence-based intervention that's been in Ontario. And we really wanted to move forward in that capacity, and we really felt that that statement suggested that perhaps we wouldn't be able to continue that work.
Were those, sorry, go ahead, pardon me.
No, I was just going to say, which we were doing with the prior government.
Were those statements that you just made to me the reasons why you did want to be a participant, why you thought things were on a path somewhere else? Was that ever said to the minister after she, according to your group, said that it would be a long 4 years?
We had some indications, if I'm understanding your question correctly, we had some indications that the program was potentially not going to meet the kids of children and families. We didn't know for sure, but some of what was shared to us, we were reading between the lines, and that was part of our hesitance.
When the minister said, according to your group again, that it would be a long 4 years, what was the response from your group?
We stood our ground. We feel strongly that the children and families that are being served in the current autism program need to continue to access services. We fear for the students or the children who are on the wait list. We want them to have services, so we really want them to, we want to work with the government to find a solution that works for this varied population. But what was put in front of us wasn't the solution, and so we are sticking to our belief that there has to be meaningful collaboration. There has to be a discussion where we share what the research is telling us, what clinical experts are finding in their experiences, where families come to the table, and that there's a real meaningful collaboration between all of the stakeholders.
We did ask for an interview with Minister MacLeod on this. She wasn't available, but her office sent a statement. I want to read part of it to you and then just get your reaction if you don't mind. Her office said, despite collaborative dialogues that took place over 6 months of consultation, ONTABA was unwavering in their desire to self-regulate and unwilling to work with government to open up the sector to provide parents more choice in support services for children with autism. So what is your response to that?
I think there's two important things to respond to in that, and the first is that there's an insinuation that there was meaningful collaboration, and I think it's important to be clear that there wasn't the opportunity for meaningful collaboration. This is a difficult, there are difficult decisions to be made. We appreciate and respect that there are limits to the resources that can go into programs, but we are ready to sit down, roll up our sleeves, and have those difficult conversations. They share what their values are, we share what our values are, we figured out what our shared values are, and we work forward from there. That kind of collaboration has not happened. There were several meetings quite close to when this program was announced, which I think is an indication that many of the decisions were already made prior to those meetings. The second is about our unwavering, I'm not sure exactly what the word was.
Unwavering in their desire to self-regulate and unwilling to work with government to open up the sector.
Right. I would say that it's true that we're unwavering in our commitment to ensuring these families have the most effective and the safest treatment possible, and that ensuring that those services are provided in a quality manner. And regulation is the standard in the province, but we weren't willing to negotiate for regulation in a way that may put the future needs of children with autism in jeopardy. That was our priority, was what the program was looking like for children and families with autism.
Can I ask about the larger issue of the announcement last week and sort of the reaction that we've seen since? A lot of parents who are saying that this means actually less treatment for especially high needs kids because of the funding cap, and that it doesn't really address need. We had the minister on at the time, and she made the argument that there are these thousands of kids on the wait list. There's this, like you said, there's a certain pot of money, and they've decided that the priority is clearing the wait list, and this is the way they see fit to do it. What is the, is there another type of solution? Is there, because I see sort of this binary of 23,000 kids on a wait list, or capping the amount of funding that they can get to access the services that they need. Is there a middle ground?
There absolutely is, and that's what I think many stakeholders in the community from a variety of disciplines would like to come to the table to talk about. I think one of the important things to keep in mind is that those 23,000 children, there are a number of those who have not accessed services, but there are also a number of those children who have access services. So sometimes that number is used in a way that may not be actually reflective of what's actually happened for children in the autism program. But there are fiscally responsible ways to approach this that are available as models out there. And I think if we sit down and we look at how do we direct the available funds where the children with the highest needs get the amount of intervention that they require at the right time, and that the children who they don't require as many needs or as many services, their needs are better met in the school system and through other resources, that they get a matching amount of the resources. So I think there's a much better way to use what is available in a fiscally responsible manner that is much more likely to produce best outcomes for these children and families and really improve their quality of life.
Okay, I have to leave it there, but thank you very much for your time. I really appreciate it.
You're welcome. Thank you.